don't do this a lot, so I apologize if I'm nervous, but I feel like you folks are really nice and you're on my side, probably, right? Awesome, thank you. So I work at Planned Parenthood Toronto. I've been there for about 3.5 years as staff, and I was there for 2.5 years as a volunteer before that, in the same program that I run. And the program that I run is a peer education program, working one-on-one with youth in the clinic at PPT. So it's youth 18 to 29. We give them 30 hours of training and then like 3 to 6 months of shadowing with other volunteers. Sure. So we give them about 30 hours of classroom training and then 3 to 6 months of shadowing with other volunteers. And then they work in the clinic, talking one-on-one with youth who are coming in for an STI test or for birth control for the first time, and explaining to them what's going to happen when they talk to the doctor and nurse and what their options are. Explaining that like getting STI testing isn't the same for every single person and what the different tests are. Giving people pregnancy tests, getting people Plan B. If people know that they're pregnant, talking them through what their options are, helping them figure out how to get to the next steps in terms of what their options are, whether that's like helping them to book an abortion appointment, whether that's getting them the information they need to get in touch with an adoption counselor, whether that's doing an intake for prenatal care at our center or getting them connected with prenatal care elsewhere. We also do a bunch of questions. We talk to people about IUDs, which is super exciting. And just like whatever people come in with. We get a bunch of teenagers coming in who just have a ton of questions, and usually they'll come with their friends and they'll laugh the whole time. We get a lot of non-insured folks coming in because we're a community health center, and so as Monabi was talking about yesterday, we have funding to care for non-insured clients, and we're able to see them when a lot of other centers aren't. So I'm going to go through a little bit about what Planned Parenthood does and the different resources we have, because we work a lot with midwives, but when we work with midwives, we often find that when we're talking to a new midwifery practice that we haven't talked to before, they don't know who we are and they don't know what our services are. So it's really good to have this opportunity to chat with you. Okay. So Planned Parenthood Toronto is a community health center, like I said. We don't have a geographic catchment like most community health centers. We have an age catchment. So we see youth between 13 and 29. So as soon as youth are able to access anonymous, confidential healthcare in Ontario, we can see them, and we can see folks until they turn 30. We do health services in the clinic. We do a bunch of community programming and outreach and workshops in the community. And our mandate is to give youth positive, sex positive, pro-choice, LGBTQ positive services. So I'm going to talk a bit about our community programming and the different range of stuff we have there. So we do a bunch of different things. We have young parents programs, so that's a weekly drop-in for young parents to meet other young parents, do parenting class kind of things, or sometimes not parenting class kind of things. I think they had a dance class last year. They give them dinner, they do childcare, they give them tokens, they give them a chance to like hang out with grown-ups for a couple of hours, and if they are interested in things like dance classes, they can request activities according to their interests to be a part of the series. And they also get access to one of our health promoters who runs it, who can do a lot in terms of advocacy and support and making connections for folks. We also have this program is SNAP, supporting Newcomer Access Project. They do sexual health workshops by and for newcomer youth in the community. They're run by volunteers. Teen Health Source, also run by volunteers. It's an info website. They also have teen volunteers who they train to give information support via text, chat, email, on the phone, totally anonymously. So if folks have a ton of questions that they can't think of while they're at the clinic, folks have a ton of questions and they don't want to come into a clinic, this is where I tend to send them. They're not going to hang up on people if they're not teens, but they're funded to serve teens. But because everything's anonymous and confidential, they don't need to know how old people are. We've also done a bunch of short-term projects through community programming, including these affirmation decks, which are at the back. A couple of folks were interested in them yesterday. This was created by the Filling in the Blanks project, which was a short-term project at PPT run by a group of LGBTQ youth who were going to produce some educational materials, and what they decided they wanted to do was create this deck of cards affirming queer and trans identities and experiences and giving people some positive self-reflection tools. So they're at the back if you want to check those out. They're really, really adorable. We did a project called Queering Sex Ed, which produced a bunch of resources. We did the affirmations deck. We do stuff like that happens like every year or so at Planned Parenthood. Right now there's an LGBTQ youth initiative going on as a 4-year program with 7 community agencies and all that boring stuff. But on a less boring note, they just had this film screening they did where they screened a bunch of queer films at community agencies to try to get people out to the community agencies and have them actually visit them and see what was up with them. We also do a ton of arts-based programming, workshop series. We have a program that works with youth talking about HIV. We have some young men's programming. We have some other newcomer programming besides SNAP. There's some programs starting up for shelter-involved youth, youth in care, youth transitioning out of care. We also have an anti-homophobia program that presents in schools. Some people might have met them. Anybody know Teach? Yeah? They're fun, right? PPT also does some research. The focus is on youth. We do a lot of community-based research. The most famous one from back in the day was the Toronto Teen Survey, which the results from that are still available online. More recent work, the most recent one was actually in trans and non-binary youth inclusivity and sexual health, which ended up compiling a 24-page resource with specific instructions for providers on what to say and what not to say. And there are booklets of it at the back, and it's available online if you're interested in knowing more about that. But in the clinic, at PPT, which is at 36B Prince Arthur Avenue, right near St. George subway station, we provide care. It's always free, with or without a health card. We have primary care family practitioners. We have 3 staff MDs and 3 nurse practitioners. We focus on sexual health care, but more and more our focus is on whole youth health, which has, as we've gone through our needs assessments and talked to our clients, has meant a lot more focus on mental health, because that's what folks are asking for. It's really hard to get. We have a case coordinator who works in the clinic. We have peer educators. We have a mobile health unit that goes around the city. It's actually just this really awesome nurse practitioner named Tanya and a backpack. And she goes to shelters and does medical care there. She's so fucking badass. We have a satellite clinic in partnership with Davenport Perth Neighborhood and Community Health Center out by the stop at Davenport and Lansdowne. And that's in partnership with Loft as well. There's a legal aid clinic on site. There was a needs assessment a few years ago that showed that youth in the West End of Toronto were not accessing sexual health services, and when they asked a bunch of youth from there why not, they were like, it's too far. We want to do it here. And so that's part of what that project came out of. It's a fairly new clinic, but we're seeing how it goes. So in the clinic, people can get sexual health care. They can get STI testing and treatment, HIV testing, they can get education about sexual health, they can get pregnancy tests, pregnancy option support, prenatal care, primary care, so that's like flu shots, checkups, sore throats, sick notes. We're also doing transition care for trans clients now, so we're offering hormone therapy in the clinic. We do obviously birth control options, education, prescriptions. We are not the cheapest game in town for low-cost birth control, but we're pretty close. We do medical mental health care management, so if people are looking for medication. And then we have our mental health team, which is these folks. So our case coordinator helps people to bridge to services that we don't have on site. So if folks need a referral for housing support, employment support, legal aid, government programs, all of that, that person helps out with that and does a bunch of advocacy, accompaniment, going with people to appointments, to court dates, to whatever it is that they need. And we have 2.5-ish therapists on staff at BPT. So we're one of the few centers that is able to give free counseling for youth. We have a wait list, but we do ongoing counseling for up to a year, which is a bit hard to find in the city. We have priority access for a few populations for short-term counseling. So if folks are pregnant and they're needing counseling related to anxiety in their pregnancy, obviously that is not something that's going to be well served by a year-long wait list. So we've got some priority access for up to 5 sessions for that, and that can be kind of flexible depending on the situation. We also do some post-abortion counseling, some counseling with trans and non-binary clients. So part of the reason I think that working with midwifery is really excellent for PPT is because of the reasons why people come to us. So when people are looking for Planned Parenthood Toronto, they're often looking for one-off sexual health. We see our average client about 2-point-something times. So we have a lot of people who come here once for STI testing and then never come back. But we see a lot of people who are coming to us because they really want their care around sexual health or their care as youth to be from people who have a lot of expertise in that area. They want to know that they're going to be well taken care of. They want to know that people are going to sort of take a deep dive into it, right? We see a lot of non-insured clients. We see a lot of clients who experience or fear what Carlene Wilson-Mitchell called yesterday disrespectful care. So they're worried their family doctor is going to condescend to them, or say they're too young to have birth control, or say they're too young to have an IUD, or be super offensive about the fact that they're pregnant. They're worried that their family doctor is going to tell their parents. They're worried that their privacy and confidentiality is not going to be respected because they're young. They're worried that their autonomy and their choice is not going to be respected because they're young. Or because they're experiencing racism, because they don't want to talk about sexuality in their faith community, because they don't want to talk about sexuality in their family, because they're experiencing ableism with their primary care providers. Lots and lots of experiences or fears of that kind of disrespectful care. They want more decision-making involvement. They want more education. They want people to sit down with them and explain what's going on and why it's going on and what their options are, and involve them in those choices. And sometimes it's because of a lack of local resources. It's because they Google sexual health care and Planned Parenthood comes up because we have that name recognition. Sometimes it's because they need additional advocacy. And most of those things that are things that overlap a lot with, I think, the reasons why a lot of people seek out midwifery care. People want midwifery care because they want folks who are specifically dedicated to the issue they're addressing. They want respectful care, they want more education, and they want more decision-making involvement. And because we have that name recognition, and people come to us first a lot of the time, and because we don't have a geographic catchment, when it comes to folks who are coming to us for lack of knowledge about other resources, we have a really big opportunity to forward people to resources that are more fitting for them if we are not actually the best place or not the only place for them. So that comes in a lot when we're referring to midwifery. When people are getting prenatal care at PPT, they come to the volunteers first. So that's my volunteers. They're awesome. There are a couple of folks in the room who trained as volunteers. I lose more volunteers to midwifery programs than anything. So they come in, they talk to a volunteer, we do a really basic intake, high risk, low risk health conditions. Do people need a referral to the case coordinator for any sort of social determinants of health stuff that might be going on that they might need support around? If they're low risk, we assign them to a nurse practitioner. If they're high risk, we assign them to an MD. We're a family care center. If they're really high risk, they're probably going to get referred out to OB almost immediately. But if it's like they need somebody who can also manage their antidepressants, then we're going to assign them to an MD. Thank you. We do care up to 28 weeks. We do transfer of care either at 28 weeks or realistically most of the time way before that, often as soon as they get an appointment with their midwife. Because we try to get that going as quickly as possible. When we're referring to midwifery, obviously clients can self-refer. The volunteers help out a lot because we're seeing a lot of non-insured clients. We're seeing a lot of clients who are new to the country, new to the city, new to navigating the health system. We're also seeing a lot of young clients who are new to navigating booking their own appointments, navigating the health system on their own. So we do a lot of support around like pulling up the website with them and helping them to input their information, taking down their information and inputting it for them, helping them to like read the map on the AOM website to figure out where they are and which is closest to them. We do that all in our intake appointment because we do think that having that information as early as possible is super important. We also unfortunately have to do a lot of talking about money because while we're a CHC and we can provide coverage and we know midwives can, a lot of our clients who are not insured, it becomes an issue, especially with the hospital fees. That's about it. So Planned Parenthood. I brought some resources. We produce our resources in-house. On sexual health resources, they're in the back. I just brought a small sampling. I brought the affirmations decks. I'm going to hang out at the back near the resources until I think the end of the next break, and then I'm going to have to take off. If you want to come chat, come chat. sometimes I see people from Alliston. I think the furthest I've seen clients is Sault Ste. Marie.
So I just wanted to speak a little bit to the connections that you have with some of the clinics and where we've like or
some of the admin staff at the midwifery clinics have saved my life so many times. I've been now handling the referrals to midwifery for about a year and a half to 2 years. I have never failed to get a client midwife who wanted a midwife. I'm very proud of that. Especially that, like, up until the last few months, it was super hard. If someone came in past like 12 weeks, to find anybody who was still accepting for that time period. Something I think the last group graduated in June or July, and suddenly all of the practices are way easier to get into. There's some sort of critical point that just happened. So I'm so much less stressed about that in the last like 4 months. Because we have no geographic catchment, we have to work with all of the clinics. So I'm talking all the time with the admin staff at West End, at North Don River Valley, at South Riverdale, at Kensington, at the Midwives Collective, at basically every place in the city. Again, most of our clients are uninsured who are coming to us for prenatal care because they're folks who are not wanting to get it from their family doctor. And so the hospital that people deliver out of is such a huge factor in where we're going to send them for midwifery care. We can't send uninsured clients to 7th Gen because they deliver out of Sunnybrook, and Sunnybrook's facility fees are bananas. But the practices that we've worked with have been super helpful in all ways that they can be, and super lovely to work with, even when I'm calling them up every day to pester them and see if they've processed our file yet. Sorry, I don't know if that answers your question.
I'm wondering if you ever force keep midwives working directly out of Planned Parenthood, and if your volume of prenatal care is for that.
Currently, we have 6 regular staff practitioners. We can see about 15 prenatal clients at any given time. We rotate that through, and we see about 50 or 60 clients a year. Right now, our building is very small, and we're not moving anytime soon, so not our current building, but I think the idea of working in collaboration with midwives is really interesting to a lot of the providers. A lot of the providers actually also just had babies, and so our nurse practitioners have all worked with midwives, which is really interesting.
I'm just wondering, so obviously there is no catchment area, but realistically it's difficult for people to travel in a situation. So is there anything like Planned Parenthood in other centers?
There are some things in other centers, not anything that's specifically doing all of the things that we're doing that I've heard of. I think that's why people are